Hi, my name is Jordan Rash. This is my presentation. These are my parents, my audience right now. Okay, so today I will be presenting, welcome to Microbiology 2420. My name is Jordan Rash, and today I will be presenting the virus that is respiratory syncytial virus. So what exactly is RSV? RSV was first discovered in chimpanzees in 1955, and after further research, it was deemed a human pathogen. It is a negative sense single-stranded RNA virus. Structurally, it is a spherical bilipid envelope that surrounds a ribonucleoprotein core. It consists of both spherical and filamentous particles. Those particles can vary in size, and it contains various membrane proteins, as can be seen here in the picture. Those proteins, two of the more important proteins are going to be proteins G and F. Attachment glycoprotein G is going to be seen here, and fusion protein F is going to be seen here. So the attachment glycoprotein G is going to function in attaching to the host cells, and the fusion protein F is going to function in completing the fusion of the attachment to the host cells. And the protein G does so through subunits of disaccharides called glycosaminoglycans, and protein F does so through ROA. So how can RSV be contracted? RSV can be contracted through droplets that can be coming from a sneeze, a cough, even talking. It can be, of course, contracted when coming into contact with an infected person already, through kissing, sharing drinks, surfaces, and it has an incubation of 2 to 8 days. So actually RSV can live on hard surfaces for up to hours on end without being affected or before it is killed off, and on soft surfaces it can usually live up to only 1 hour. So how does RSV exactly affect the human body? The RSV specifically targets the respiratory tract, so that includes the lower and the upper respiratory tracts. It targets the ciliated cells in the bronchioles and the basal cells in the epithelium of the airway. So in this picture right here, we have an infant who has contracted RSV, and it has directly targeted his primary bronchioles. It has inflamed the bronchial wall and caused mucus and an obstruction of the airway. And an average of 35% of infants who contract RSV have issues with their lower respiratory tract, which includes the bronchioles and the lungs. So what exactly are the symptoms of RSV? How do you know if you have it or your child has it? So some of the common symptoms are going to be sneezing, coughing, of course shortness of breath because it's affecting your upper and lower respiratory tracts. Fevers are usually going to range from anywhere from 100 to 104. Inflammation of the airways, because again it's targeting your basal cells and your ciliated cells in the bronchioles, and infection of the lungs, because usually if you have RSV, pneumonia, fluid in the lungs can coincide with each other. So where and when is RSV most commonly contracted? RSV is actually a global virus. It is seen in every continent, every country. Doesn't really matter the race or ethnicity of the person, anyone can contract it. However, there has been research studies that have been done that show that about 4% Black non-Hispanics on average contract the virus 4% more times. It is more commonly seen in the fall and the spring. The reason for this is there's going to be colder temperatures, so more people are going to be inside the house, which means that there's going to be more people that are going to be able to spread the virus. Also, if the host has a lower internal temperature, that means that they're going to be more susceptible to contracting the virus. And also, RSV is more commonly contracted in developing countries. They are going to be the ones at the higher risk of contracting the virus. This is mainly because there's less access to healthcare, less education, and I'll explain in a little bit as well, but there's just going to be even less detection tests for RSV. An example of these two developing countries are going to be Argentina and Kenya. Argentina and Kenya were actually two countries that accounted for 1/3 of the global deaths, according to one research study. So who exactly can contract RSV? RSV is most commonly seen in infants and mainly just children under the age of 2. It is also seen in elderly patients and elderly adults, child caretakers who work in the daycare setting, or are nannies, just overall exposed to young children, and people with pre-existing health conditions. So since the respiratory syncytial virus is a respiratory virus or attacks the respiratory system, it's going to affect people with lung issues, people who are already immunodeficient, and people with heart problems as well. So how is RSV treated? As of right now, RSV is so prominent because there isn't a true vaccine for RSV. Of course, since it is a virus, it is a viral infection, so antibodies will not work in treatment. But as of right now, palivizumab is a monoclonal antibody that is the most effective at the moment in treating the virus. It's going to act by, it's shown in this picture right here. So this is an RSV virus cell. This is going to be the palivizumab antibody. And these purple filaments right here, these are going to be the membranous proteins that are going to attach to the host cell. And the antibody right here is just going to be blocking those attachment sites so it can no longer attach to the host cell. Another medication that is currently approved in the US but is not recommended is going to be rabivirin, which is going to be an antiviral medication. It is not extremely recommended due to its high costs and efficacy. It's not completely effective, and it's also not that safe for health professionals who are administering it. So because RSV is a single-stranded negative sense RNA virus, it is constantly mutating and evolving. So the scientists have issues with creating a vaccine. So in one clinical study that was done, 80% of the children, young children under the age of 2, who had already been infected naturally by the virus were hospitalized and to experience deaths. So the vaccine is very hard to create. However, if you don't have extreme symptoms where you don't need to be hospitalized, pain relief medication and fever reducer medication that are found over the counter are highly recommended by doctors. And of course, if you are at the higher risk, you will need to be hospitalized, and hospitalization treatment can range from incubation, ventilation, and extra oxygen due to the obstruction of airways. So how can you prevent the spread of RSV? RSV can be prevented in simple methods that would be used to prevent the spread of the common flu or the common cold. Just proper hand washing, covering your coughs and sneezes, avoiding already infected people with the virus, and disinfecting surfaces, because again, RSV can live on surfaces for hours on end and you can contract it without you even knowing it. These are going to be my references. Thank you so much for watching, and hope you have a great day.